Greetings, ladies and gentlemen. First of all, let us thank the God Almighty for giving us the chance to present our student project from small group discussion B8 with the title of Early Detection of Cerebral Palsy. And next is the member of our small group discussion. There is 12 of us, and today in our presentation we will be covering on the introduction and of the urgency on our student project and the literature review and also the conclusion of our project. So without further delay, please let me allow the first one to explain their part on the introduction.
Let me introduce myself. My name is Niputo Yudianika Surawi with last three-digit NIM number 164. I will explain about the introduction of this student project. So cerebral palsy is caused by a neuromotor disorder of the developing brain that affects the development of child's movement, muscle tone, and posture. Even though this disease cannot be cured or the duration of this disease is lifetime, there are steps that can be taken before, during, and after pregnancy to prevent a child from getting CP and detect this disease early so that the mother can immediately follow up with medical treatment earlier to reduce complications that could come from this disease. Next.
My name is Denisa Nadira and my last three-digit number is 160, and I will explain about the problem statement, the objective, and the benefit. So the problem statement for this paper will be first, what are the causes, symptoms, diagnosis, and treatment for early detection of cerebral palsy, and how to perform early detection of cerebral palsy. The objective will be to know the causes, symptom diagnosis, and treatments to early cerebral palsy, and to understand some methods and how to detect an early cerebral palsy. And the benefit will be readers could gain new knowledge and providing information for future research and works. Next.
Hello, my name is Misal Karnaputra and my last three-digit NIM number is 167. I will explain about the definition of cerebral palsy. Cerebral palsy is a neuromotor disorder that can affect to the posture and paralysis to muscle movement. This will cause injury to brain development at prenatal, 0 until 9 months, to neonatal, first 4 weeks after birth. The incidence of cerebral palsy reached 1.5 until 3 per 1,000 births with variation between high income and low to middle income countries and geographic region. Cerebral palsy can have an impact on the child motor syndrome until he experiences paralysis such as hemiplegia and spastic diplegia. A child who has cerebral palsy will often experience excessive reflex, bad gait, crossed eyes, and intellectual limitation. Next.
Okay, let me introduce myself. My name is Yanti Graciela with my last three-digit NIM number is 162. Cerebral palsy can happen to infants because of the tendency for parents to not know about the multiple factors that can influence the risk of CP. And many studies report that half of the children affected by CP are born without identification of risk factors, which can ultimately exacerbate the risk of CP. In the end, they will find it difficult to adapt to the wider community because of the impact on cognitive decline that is not treated promptly. Infants who are premature and below the threshold of normal birth weight are the main factors that should be given more attention to reduce the risk factors for cerebral palsy. And usually, this is also accompanied by an infection during pregnancy, severe jaundice shortly after birth, failure of the placenta to supply food, and oxygen to the developing fetus. Next.
Hello, my name is Putwardhani Purwasini Astawa, and my last three-digit number is 161. So far, the reason why babies can develop cerebral palsy is not known, which is apparently because it has variation in these factors and causation. But it is caused mainly by abnormal brain development or by damage to the baby's brain. There are several major factors that affect abnormal brain development in infants. The first is demutation. Genetics can affect the increased rate of developing cerebral palsy because mutation in the wrong gene and not in the other are the cause of several diseases. Next, second is mother's condition. It is not thought to be distributed as a result of the mother's own condition. If the mother has an abnormality or an unhealthy lifestyle, it will affect the baby's development. Next will be explained by my friend.
Hello, my name is Adelia and my last three-digit number is 165. The next one is brain and head injury. Traumatic brain and head injury are called neurotrauma. Neurotrauma is an injury to the nerve tissue caused by an accident intentionally or not, such as trauma from a motor vehicle accident, physical violence, or a fall. Next. The next one is PROM. The root that causes preterm birth is rupture of the amniotic sac and chorionic sac before 37 weeks of gestation due to fetal membranes weakened, contraction forces, or maternal infection. Premature babies do not fully experience the organ maturation, so brain is susceptible to damage and prone to develop clinical illnesses. It puts infants at high risk for emerging non-developing brain cells that can lead to cerebral palsy. Several other risk factors are found. Therefore, cerebral palsy has multifactorial etiology and is characterized primarily by fetal or neonatal brain injury.
Hello, my name is Adam Zulfikar, and here I'm gonna explain about signs and symptoms of cerebral palsy. The impairment of developing fetus or immature brain could lead to several disturbances such as cognitive impairment, motoric, sensory issues, and other abnormalities in vision, hearing, and speech. In cognitive impairment, for example, like delayed language acquisition, and then speaking and responding to people are difficult, having trouble concentrating and having a limited attention span, and then having trouble learning to read and count, and then sensory stimulation problems, and then abnormalities in emotions such as inappropriate anger, anxiety, and melancholy. In motoric issues, for example, between the ages of 3 and 6 months, for example, when lift up while lying on the back, the head drops back, then feels rigid, appears floppy, being gradually in someone's arm, seems to have an extended back and neck. When lift, legs become rigid and cross or scissors. When a baby is older than 6 months, for example, doesn't roll over in either direction, cannot join hands in a fist, has difficulty bringing hands to mouth. When baby is older than 10 months, lopsidedly crawls, dragging one hand and leg behind the other while pushing off with one, moves around on the buttocks or bounces on one knee but does not crawl. In sensory issues, for example, disturbance in the visual, vestibular, and multisensory regions of sensory processing, disturbances in the modulation of sensory processing, including modulation related to body position and movement, modulation related to tone, and modulation of sensory input affecting emotional responses. And then there are problems with social emotional reactions to sensory input, like emotional social responses, before behavior outcomes of sensory processing, response results. And then impaired sensory processing factors like low tonus or endurance, distractibility or inattention, poor registration, sensor sensitivity, sedentary, and then fine motor perceptual.
Next is diagnosis. Early cerebral palsy may take multiple measures or steps to diagnose. First is developmental monitoring. Doctor will track the child's growth at each check-up appointment by asking parents whether they have any concern about their kid's growth, taking or updating the child's development history. Next. Second is developmental screening, to see whether the kid has any particular developmental delays, such as mobility or motor delays. The exams take the form of parent-completed questionnaires or interviews, while other exams are administered to the child by the doctor.
So the third will be developmental and medical evaluation. So the doctor will carefully examine the child's motor abilities, muscular tone, reflexes, and posture, such as any movement or motor delays, in addition to taking a thorough medical history from the parents. However, a definitive diagnosis of CP is quite difficult to make with certainty within the first 1 until 2 years of life, and more trustworthy after 2 years of age. Next.
And for the early detection methods, the early detection of cerebral palsy is important to ensure specific intervention to minimize the impact of CP. Early diagnosis and treatment are critical to prevent or at least minimize the handicapping effect of a disability caused by CP and to offer the best chance of achieving the maximal benefit of the treatment. Next. The evolution in early detection methods start from the 1970s. Its clinical sign to identify CP is the retaining of primitive reflex and an additional cranial ultrasound, shortened as CUS, to identify brain lesions. And the next decades, in the 1980s, after understanding the neuroimaging modalities, magnetic resonance imaging, shortened as MRI, could be used to predict CP. On the next decade, 1990s, general movement assessment, or GMA, was first described and considered as the biggest leap. And now, two pathways by using GM, Hammersmith Infant Neurological Examination, or shortened as HINE, and etc., could be used to do early detection of cerebral palsy itself. Next.
Okay, let me introduce myself. My name is Wildan Salmasdar. The last three-digit number is 174. So now we're at the major pathways for early diagnosis of cerebral palsy. The first pathway is used for infants younger than 5 months of age. This strategy is also known as the newborn detected risk. Use first general movement assessment of GMs, brain magnetic resonance imaging or MRI, test of infant motor performance of the IMP, and Hammersmith infant neurological examination. GMs plus abnormal brain MRI indicating damage to the motor area and accurately predict CP more than 95% of the time and strongly recommended. The DIMP can also predict CP for about 61 to 90% of the time. The second pathway is for infants older than 5 months of age. This detection strategy is also known as the infant detected risk pathway. Hammersmith infant neurological evaluation and the development assessment of youth and children or DAYC and the Alberta Infant Motor Scale or AIMS and the Neurosensory Motor Development Assessment or NSMDA are used. The HINE plus brain MRI accurately predicts CP for 90% of the time and is strongly recommended. The DAYC accurately predicts CP 80% of the time. The AIMS 86% predicts CP and the NSMDA can 82% predict CP and can be used as supplementary assessment for predicting abnormal motor outcome. That's for the methods for early detection. Thank you.
Okay, for family interventions and treatments, the first one is family-centered services, which is used to introduce and facilitate care for children with special needs and their families. When early interventions performed in the hospital, family has less involvement in the process. Therefore, it is well suggested that therapists or medical professionals who handle children with cerebral palsy include the parents in the care of the child, because ultimately they are the ones who have to care for them outside of the hospital without support. And on the second one is medication and surgical procedures. Medications such as diazepam, baclofen, and injections of botulinum toxin type A are given to assist movement issues as they affect the spasticity of muscles. Aside from that, selective dorsal rhizotomy or SDR is a neurosurgical procedure to permanently reduce spasticity in the legs of children with cerebral palsy. Next.
Hi, my name is Patricia Orlin Jotan, and the last 3 digits of my student number is 171. So for the treatment, step therapies, although cerebral palsy cannot be cured, treatment frequently improves a child's abilities. The earlier the treatment begins, the higher the chance children have of overcoming developmental problems. There is no standard therapy that works for every person with CP, but there are a few types of therapies for CP. The first one is physical therapy, then occupational therapy, recreation therapy, speech and language therapy, and since children with CP have little control over the muscle that move their lips, jaw, and tongue, treatments for eating and drooling are frequently required when they have trouble eating and drinking. Next. Assistive devices such as computers, computer software, voice synthesizer, and picture books can greatly help some individuals with CP to improve their communication skill. For example, orthotic device, plates and braces, wedges, custom seats, and other equipments can make it easier for them to sit comfortably. And the use of wheelchair, rolling walkers, motorized scooters, and the others. As for the future treatments, researchers supported by the NIH keep exploring new rehabilitation approach for CP patients. One of the studies is called functional electrical stimulation, the therapeutic use of low-level electrical current to stimulate and restore muscular mobility, which is an effective technique to target and strengthen spastic muscle. Another potential avenue of research is the use of stem cells. Stem cells have the ability to develop into different types of cells in the body and may be able to help repair damaged tissue in individuals with cerebral palsy. Although the improvement is not great, stem cell treatment for CP significantly improves gross motor function when compared to symptomatic conventional care alone. This is short-term safety, but more high-quality randomized controlled clinical trials are required. That's all from me. The next one, please.
Hello everyone, my name is Chandran Hansantoso with my last student number is 170. Conclusion: cerebral palsy is a neuromotor disorder that affects posture, causes paralysis to muscle, and injury to brain development at prenatal to neonatal, caused mainly by abnormal brain development or by damage to the brain. Symptoms are cognitive, motoric, and sensoric impairments, while diagnosis are done by developmental monitoring, screening, and medical evaluations. Early diagnosis of cerebral palsy are done using practice general movement assessment, brain magnetic resonance imaging, test of infant motor performance, and Hammersmith infant neurological examination for infants younger than 5 months of age. And Hammersmith infant neurological evaluation, the development assessment of youth and children, the Alberta Infant Motor Scale, and the Neurosensory Motor Development Assessment are used for infants older than 5 months of age. While cerebral palsy has no cure, there are treatments to improve quality of life of children affected. Medication and surgical procedures are done to those with more severe cerebral palsy. Future treatments are being developed that can further improve rehabilitation in children with cerebral palsy. Next. This is all for our student project of student group P8. Thanks for watching.